Good morning, Speaker. My question is to the Premier. Earlier this month, the London Health Sciences Centre was forced to close their world-leading Epilepsy Monitoring Unit due to critical staffing shortages. The unit being closed and a lack of access to EEGs means even more delayed surgeries. Think of the impacts to the health, the mental health, and the quality of life of patients suffering from seizures. When will this government admit the crisis in healthcare is real and address the staffing shortage that they created?
Minister of Health.
Thank you, Speaker. Again, this question will highlight some of the work that we've already undertaken with the Ontario College of Nurses, with the College of Physicians and Surgeons of Ontario to expedite the internationally trained experts in healthcare who want to practice in the province of Ontario. We have asked and directed those two colleges to make sure that people who have applied have their process going through very quickly so that they get that accreditation, they get that licensing, because the member is right. We need to increase the supply of healthcare workers in the province of Ontario. I would add, respectfully, that this is not unique to Ontario. As recently as 2 days ago, I was meeting with the FTP, Federal Provincial Territorial leaders, to talk specifically about what Canada can do and how they can assist to make sure that those internationally trained individuals who want to practice in Ontario can do so quickly. Thank you.
Respectfully, through you, Speaker, Bill 124 is unique to Ontario. People on waiting lists are waiting even longer, and it is because of the disrespectful policies of this government. Epilepsy patients, like Sarah, live in fear, wondering when their next episode is going to happen. Clearly, the Minister of Health wants to peddle privatization as a cure-all for the crisis Conservative cuts have created. Overworked and underappreciated by this government, then Bill 124? It's a perfect storm. Will this government finally admit they got it wrong, repeal Bill 124, and finally treat healthcare professionals with respect? Yes or no?